In Texas, early state data shows the number of infant deaths has increased more than 7% since 2021. This week, on Inside the Investigation, investigative reporter Arzo Dost explains how a new law is giving Texas families more time to say goodbye. Welcome to Inside the Investigation. I'm Kelly Wiley, and I'm here with investigator Arzo Dost. Thank you so much for joining me, Arzo.
Thanks for having me, Kelly.
Arzo, your story resonated with so many people, and when you watch the story, it's not hard to understand why. Infant loss is something that a lot of people don't want to talk about, but it is something that more and more families are experiencing in Texas. What do we know about how often babies are passing away in our state?
Well, we know, Kelly, that the state health department tracks infant mortality and losses and is trying to get a better understanding of why this is happening. You know, in the last several years, as a state, we were trending down, but we really started to see the numbers of infant losses go up about 7.7% since about 2021. And the leading causes, according to the state, birth defects, preterm births, and sudden infant death syndrome, or SIDS. Now, you know, they're presenting the data, but not necessarily analyzing it. So it's there for us to see and explore, but what the leading causes are beyond what they've shared, there's really no other details.
Which I know is something that you want to explore so much, because when you're looking at the numbers go up, you're wondering what's going on there.
Right, and you know, after our story aired, there was a lot of conversation, especially on social media, about could this have been because of the near abortion ban? Well, the state says we're just presenting the data. We don't analyze it at this point. Now, could that change down the line? Maybe. But right now, what we do know is that the numbers have been trending up, and it has caught the attention of lawmakers to the point where they felt like they needed to do something about it.
I have not had a child, and it really didn't register to me until watching your story that after losing a baby, there's a next. There's things that need to happen. There's kind of this moment in time that families need to go well for them. What about Texas hospitals and how they handle infant deaths made it so that lawmakers felt that they needed a bill or legislation to help coping families?
Kelly, this is such a hard topic to talk about, right? Having 3 kids myself and having talked to so many parents, this is not something that is easy to talk about, their grief, but they wanted to talk about it because they want to normalize this. This is happening, whether we like it or not, across the state, across the country, and it needs to be talked about. And these children, these losses need to be remembered in a way that is in a dignified way. And so what caught lawmakers' attention was honestly a door knock in North Texas. Lawmaker Representative Mihaela Plisa from the Plano area in North Texas, she was knocking on doors right before election time and came across a family in that area that said, I've gone through a loss. There weren't a lot of resources. How can you change this? And it took that one mother to push this law through. And because of this state rep and this family and several other families that came forward and shared their stories, we now have this law in the books since September, where it is now a requirement for every hospital that has a maternity ward in the state to have a cooling device of some sort so that you could preserve the baby's body up to 72 hours. Because after a loss, a baby's body decays so quickly that time is what really matters.
How many hospitals already have had this technology before the law passed? Because it's not something that I've heard of before.
No, it was very limited. And the most interesting thing is that, you know, one of the comments we kept hearing is when you go to the hospital, if you have a heart attack or if you have a stroke or if you have any other issues, there's standard protocols for how all of these illnesses, diseases are handled. Not when it comes to infant loss. Every hospital may have different guidelines. So this kind of gives every hospital is standard. So not only are they required to have these cooling technology bassinets, but they're required to provide their staff with training so that families are able to process this grief and this loss in a way that is respected and dignified.
And I remember you saying that you'd made phone calls to these hospitals to try to figure this out yourself.
Yeah, I was curious too, because unless you've gone through such a, tragic loss, you may not know if your hospital has one or not, and specifically in rural areas where the resources are limited. So I just one day started calling different hospitals around me to see who had it and who didn't, and then I reached out to their point of contact for us, to see what they would tell me. And it turns out, for instance, St. David's, all their maternity wards have them. Okay. Ascension, all their maternity wards have them. It's either, there's two companies right now that provide them. It's either called Cuddle Cots or the Caring Cradle. And so, and if they don't have it, they want to know that you need it so they can figure out a way to get it. Baylor Scott and White said that they are doing everything they can to be there for families who go through this tragic loss, but they wouldn't specify if they had them or not. Even when I called, I couldn't get a clear answer. So really the bottom line is, now that the law is in effect, if you want to know if your hospital has one, you should just call. And if they don't, then the state health department has a webpage, where they have all this information, and people can even donate this technology to hospitals.
I'm curious because so many times I feel like we've done stories where a law is passed, but the implementation is a whole other beast to actually see it come to fruition. What does that look like now that this is law?
Lawmakers put it in the hands of the state health department and said, you've got to figure out a way to implement this, and we're giving you money to provide the funds to these hospitals. So for instance, if a hospital doesn't have the technology, help them get it, or figure out an organization that has it, and here are the resources that should be made available. We were so grateful to have talked to the Wynn family, Elaine Wynn. She had gone through something, a loss of stillbirth, and she found out that her hospital had this cooling technology, had Cuddle Cots, 2 of them, but at that time it wasn't offered to her. And so here is one mother in our area that's now making sure every hospital, every staff member in these maternity wards are aware of this technology, so that no other parent is faced with this outcome and then having to rush through the grieving process. For Elaine and her family, they had hours, they could have had days. And those days would have meant she would have brought her other little girl to meet her little brother. She would have had more time with her baby Lando to take photos, to just memorize his face, his little hands. So all these moments, these hours are so significant for the families that have had a loss.
It was a tough watch, just her interview with you, just all of the things that she had collected, trying to remember that moment and trying to remember that moment in time. What was that? I mean, you do so many of these stories that look at women who are pregnant and people who are trying to expand their families and experiencing these losses. What was that like talking with her?
Being able to have had time with Elaine was truly a gift. Here is a mother that has gone through such tremendous loss, but her goal is to keep her son's memory alive. She is keeping Lando's memory alive, and on top of that, she's helping so many other mothers. The fact that she felt comfortable enough to speak out, that means that there is going to be another mother that's going to know that she's not alone, another father that's going to know they're not alone, siblings, grandparents. And any time that we have a family that shares such a personal story, how thankful are we to be able to earn that trust and to be able to share their stories. They're speaking out not because this is happening more and more, which it is, but they're speaking out because they want to normalize this. They want families to understand you're not alone. I may have gone through this by myself, but you're not alone.
Right, trying to make it better for the next
Absolutely.
group of families. Arzo, you're constantly looking at this sort of reporting, and this is something you're always looking for, because you said you looked at this issue because you were just looking through new laws that were applicable to people who were having babies and to hospitals and maternal care. What are you looking for next? What are your takeaways from this story?
Well, one, I want to know, once the state health department is done implementing everything, which will take some time, I want to know how it's working out for hospitals when it comes to this law. But as a state, there's been a big emphasis not only on maternal health, but infant health. And I want to see what else we're going to do as a state. You know, Representative Plisa said, this is one piece of it. We've got to, as a state, figure out why we've got infant loss, why we've got moms that are still dying during childbirth. Right. And we as a state need to tackle that. So this is her in to do that. Once she said next session, there's going to be a lot of other legislative pieces that come together because of this.
Mm. Arzo, thank you so much for your reporting. Please watch Arzo's story if you already haven't, and obviously take care for yourself if it's overwhelming or too much to take on. But if you can, definitely watch Arzo's story, because it's such an important issue, and I appreciate you coming and talking to us today. Thank you guys for watching, and you can watch all new episodes of Inside the Investigation on the KXAN Plus app every Friday starting at 1. Just search for KXAN on your preferred streaming device, Roku, Apple TV, Amazon Fire. You can also listen to our Investigative podcast, where we feature audio versions of our weekly Inside the Investigation episodes. You can find new episodes every Saturday morning wherever you get podcasts. Just search for KXAN Investigates. Thank you for watching.